Tracheotomy or tracheostomy. Introduction. A tracheostomy is a procedure that places a tube through the front of the neck into the trachea. Select true or false. Correct. The trach tube goes into the trachea and serves as a windpipe. Aspiration is the passage of air from the mouth into the lungs. Select true or false. Correct. Aspiration is the accidental passage of food or saliva from the mouth into the lungs. When performing a tracheostomy, the healthcare provider makes a small opening in the middle of the neck and inserts a breathing tube. Select true or false. Correct. During a tracheostomy, there is always the risk that important structures in the neck can be damaged. Select true or false. Correct. Blood vessels and nerves in the neck, as well as the feeding tube, can be damaged during the procedure, but these complications are rare. After the procedure, the tube may rub against the inside of the trachea and cause you to feel dizzy, lightheaded, and even pass out. Select true or false. Correct. A cuff allows air to pass through the area between the tube and the inner wall of the trachea. Select true or false. Correct. A cuff prevents air and food from passing between the tube and inner wall of the trachea. Most patients' first trach tube is a tube with a cuff. When the patient showers, the tracheostomy should be covered. Select true or false. Correct. The area around the tracheostomy should be kept dry. Thank you for using Explain.